Good evening, everyone. Thank you for joining us for a special masterclass that will teach you how to kick your birth control pill for good. My name is Britt with Forum Health. For those of you not familiar, Forum Health is an expanding nationwide network of industry-leading healthcare providers who serve patients with a root cause approach to care. Our network of practitioners have decades of functional and integrative medicine experience drawn from areas in clinical nutrition, anti-aging, environmental medicine, chronic disease, lifestyle medicine, and much more. For more information, visit us at forumhealth.com. All right, let's get started. Our speaker tonight is family nurse practitioner Alicia Barkholtz of Forum Health Fond du Lac. Alicia is certified in adult and family medicine through the American Academy of Nurse Practitioners and has experience in hormones, weight loss, women's wellness, and thyroid function. Welcome, Alicia.
Hi, thanks for having me.
Well, thank you so much for speaking with us tonight. Synthetic birth control, about 150 million women worldwide are currently on some type of synthetic birth control pill. However, many women experience negative side effects that they don't even really realize how it affects the body, the brain, and their overall health. So to start off, what really defines synthetic birth control, and what are some of the reasons doctors prescribe it?
Sure. So synthetic birth control is essentially a medication that mimics the hormones that we produce in our body. So your body is flooded with these synthetic hormones, which then suppresses our production, our ovary production of producing our natural progesterone and estrogen. So many people think, and I'll just use the pill as an example because that's a pretty standard one for everyone, that when you go on the sugar pills, you are having a period, but in reality, you're not, because you have not ovulated at all, because our normal hormones are completely suppressed. So that withdrawal bleeding is a withdrawal from the synthetic hormones. So you're not ovulating, you have no natural progesterone or estrogen being produced in the body. A lot of synthetic birth control, there's the pill, NuvaRing, IUDs, the Nexplanon, which is the one in the arm. Those are probably the most common. So there's a lot of different routes and avenues that people can take, to be on synthetic birth control. A lot of people can be on it for PMS symptoms, especially with like heavy bleeding, terrible mood swings, PCOS. I've seen some women in perimenopause who are on it to kind of help some of those menopausal symptoms as well. So there's a lot of different reasons why people may be on synthetic birth control and a lot of different ways they can be on it as well.
That's great. What are some of the side effects that women might experience from taking synthetic birth control?
Yeah, so it can definitely help with some symptoms that women experience, like the PMS, heavy bleeding and things, but there also comes with a whole slew of other side effects. Those can include issues with joint health and bone health. You're at a much greater increased risk of osteoporosis. Women need natural estrogen to help prevent osteoporosis. So when we're suppressing that completely, then you are at a greater risk for that. It can affect the thyroid, and the thyroid in itself controls so much in our body. And a lot of women struggle with thyroid function in general. So being on synthetic birth control just heightens that. It can also affect the gut flora. So you can be at increased risk for yeast infections, which are obviously no fun. And there's also an increased risk of cancer being on synthetic birth control as well. So
Interesting. Yeah. So a lot of really negative side effects. And I know many women listening tonight, myself included, have definitely experienced over the course of their life. I'm curious to know how synthetic birth control particularly affects your mind, and really, are there any effects with depression or anxiety, any type of mental health effects with the birth control?
That is a great question.
Yeah.
There is a greater increased risk of anxiety, depression, decreased sex drive, increased mood swings, and also kind of that overreacting, over rationalizing that a lot of women can experience can be heightened with the birth control as well. So you can get a lot of physical effects from it and the mental effects as well.
Definitely. I know a lot of women listening tonight are always curious about their hormone levels. What is an optimal hormone level? What does a woman really need for her body to function properly?
Yes, that's a great question. So when women come to me, I always tell them that our goal is to get them back to their 25-year-old self.
Mm.
So statistics have proven that women at 25, their hormones are the perfect spot. Women feel the best. That's kind of where we've gone away from puberty, have mellowed out before everything kind of goes downhill after that.
Right, unfortunately, yes.
Right. So we shoot for that 25-year-old hormone level. So when you're looking at labs, we're really looking at that luteal phase. So the luteal phase of the cycle comes after ovulation. And that is when women generally feel the best before they get their period. And so when looking at a lab, you're looking at that luteal phase. So labs are all kind of different. When I do lab draws from a venipuncture, just from the arm getting blood, I wrote it down here so I didn't forget. The estradiol I'm looking at is 43.8 to 211, and progesterone is 1.8 to 23.9. So the ultimate goal is to get right in between that range. To get right in between is going to have women feeling the best. It can alternate depending on what lab you use and things like that, but any printout will have the luteal phase on there. So that's really what you're going for.
Okay, that's great, because I know that's a big question mark. So it's really going back to your 25-year-old self, which we did. We all felt good at that time in our lives.
Yes.
I would love for you to talk to us a little bit more about bioidentical hormone replacement therapy. I know that's something you use at your practice. Can you tell us, what is it? How does it work? How do you take it? Kind of just the overall of this therapy.
Yes, I love bioidentical hormone therapy. I utilize it very often with a lot of my patients. So bioidentical therapy is essentially identical hormones to what we have in our bodies. That's where the bioidentical comes from. A lot of times it's made from plants. So it's very natural based, and it will respond to the receptors that we currently have in our body. So it's not causing any suppression like what is caused with synthetic birth control. So we're really going for balance. So we can utilize that for women who are low with one or high with another. We really try to get a really good ratio between progesterone and estrogen, so we can use bioidentical hormones to get that balance. So we're still allowing the body to naturally do what it's supposed to do, right? We're still allowing it to cycle like it's supposed to if women are still cycling. If women are in menopause and their ovaries have completely shut off, well, then we can give them hormones to get back to that 25-year-old self where everyone feels the best. Another really great thing about bioidentical hormones is they really carry no side effect risk. When we can get women in that range that we want, many women have no side effects from it because it's natural. And they're very easy to use. I utilize creams a lot for my patients. There's a compounding pharmacy in Brookfield that we use. They are amazing. The creams, pretty much any bioidentical hormone therapy is going to have to come from a compounding pharmacy. So a lot of times you're not going to get that from your Walgreens or your local pharmacy. But creams, you can get some of them in oral supplement. Some of them can be injections. Testosterone can be in injections. Many women don't need testosterone. That's more men that are really looking to bump up their testosterone. But there are different routes and avenues you can go for bioidentical therapy. But I would say creams is primarily what I use. And women really, they put it on before bed and just, go to bed, and that helps to balance it. So it's really not too big of an inconvenience either.
Right. That's great. That's ideal. That fits into, I think, every woman's lifestyle, right? To be able to have it work overnight so that you can feel a lot better. Right. I'm curious to know why bioidentical hormone therapy is perhaps a better alternative to synthetic birth control.
So it really just comes down to it being natural. So it is comparable to what we have in our body. So our body is going to like anything that's natural to get it back to its prize state, right? So if we know that we feel better at 25, at year 25, that's where we want to get our body back to. So it's natural. Our body is going to accept it well. You know that you're not getting anything fake. It really just comes down to that natural balance. And that is ideally what bioidentical hormone therapy does.
Right. Yeah, I love that it's natural. I think everybody is striving for that more in their life, more natural treatments.
Yes.
I'm curious to know, how does a woman successfully and safely come off or transition from a synthetic hormone to bioidentical? And how often do you retest those hormones?
Yes, that is a great question. So for ease of conversation, I'm going to use the example of the pill because I see a lot of women that come in on the pill. So what I'll do with those women who want to come off the pill and we want to balance their hormones is I will have them finish out wherever they are in their pill pack. So, I mean, even if they're only on week 2, I have them finish it out. And then once they get to those sugar pills, then we stop. What you can do is you can bridge women with progesterone. So we know that progesterone and estrogen are suppressed with the synthetic birth control. You don't want to give estrogen right off the bat because you could put women into estrogen dominance, which can cause a whole nother slew of symptoms. So, but we can start with progesterone. Progesterone is tolerated really well. We know that that takes a while to come back up after being suppressed for a while. So I generally will have women finish their pill, start them on progesterone, and then retest them in about 90 days or 3 months. It's been proven that 3 months is really it gives the body enough time to kind of recycle, rebalance to get an accurate testing. So that's usually, so you could just stop the pill too, which is fine, and then give yourself 3 months to cycle. But if you kind of want that bridge to help a little bit, then progesterone, you can just start women on just progesterone then.
Okay. That's great. I think that probably reassures a lot of women tonight who are listening. Before we open up the class to questions from the audience, I would love to ask you, what is one takeaway that you would like our audience to have from tonight's conversation?
So one thing is that, synthetic birth control is so common in our world, right? It's traditional medicine. You go in with a complaint and you're thrown on the pill. I know I was on birth control for over 10 years for really bad PMS symptoms. I mean, it is just how our world is. But to know that there's another option and there's a natural option, and it's all about balance. So when I see patients, I treat them holistically. I get the full picture. We can go back years to when symptoms started and things like that. And to know that we're not just putting a Band-Aid on those symptoms with synthetic birth control, just suppressing things. We're really working from the inside out, and it makes it a long-term treatment, not just a short-term treatment. So it's natural, it's balancing, it's going to last you for, years to come. And I will test all of my women yearly. In the beginning, it's about every 3 months, and then it can be 6 months, but I will test every year because hormones can change. I mean, our bodies change, or, as we get older, things change. Stress, life events can cause things to change. So it's something that you keep a close eye on, but again, you can just make small adjustments to get you back to balance versus just putting a Band-Aid on and hoping that it works and then getting a whole slew of other side effects from it. So, but I don't want anyone to feel bad if they're on synthetic birth control, because that, before I started in integrative care, I mean, that's what we did. I mean, you just started women on that. So it's a newer knowledge that I'm hoping gets out more for women, but there are other options.
Definitely. And I love that you said that this is something women can take throughout their life as they transition into perimenopause and eventually menopause. It's something that you can continue forever. I know Suzanne Summers, she swears by them. And I think she's probably 75 or 80. So she's been on bioidentical hormones for a long time. But I love that. I love that you get to the root cause instead of putting a Band-Aid, and you're really able to help a lot of women lead a really full and healthy life. So I know there's probably a lot of questions from our audience. We'll probably take the next, I want to say 10 to 15 minutes to answer any of your burning questions on hormones, how to transition out of synthetic birth control, all of that good stuff. So we have one that just came in that said, how long can a woman stay on bioidentical hormones? I think you've probably much answered that really for your entire life.
Yeah, there's really, when you think of women going into menopause and your ovaries are done, they've done their job, they've gotten you through fertile years and things like that. So you really can't reproduce that because you don't have, your ovaries aren't functioning. So you can be on bioidentical hormones forever. And again, like I said, those levels can fluctuate. We can fluctuate with that as women get older, but the longer that women are on that, the better they feel. I've seen some women, in their reproductive years that we can kind of wean them back off and let their body take back over. So it's really completely individualized, but yeah, you can stay on them for years and years. And as long as they're making you feel good and everything like that, it's lifelong.
Yeah, as long as it's working for you. That's great.
Mhm.
Let's see, Claire wrote in, Alicia, do you recommend any specific foods or supplements to support coming off of birth control? And what is the best way to be able to work with you to get started on this process?
Sure. So, the supplements it's a really good question. Some basic supplements that are just good for anyone, but especially menopausal women to be on is like a fish oil, a probiotic. A probiotic is good because when we metabolize estrogen, we need to use our digestive tract to get that out. So kind of keeping a good digestion clean. There are other supplements that can help. It's very kind of patient specific though, kind of what you're coming in for, what symptoms you're having to kind of transition off. But as far as starting the transition, just to come and see me or a provider, at a new patient appointment, I generally will check labs to see where you're at. And then once we kind of know that, we can start you on creams, look at different supplements to help that. But I would say there's not a great answer for that because it's going to be very symptom based as to kind of why we're transitioning and then what supplements can help make that transition.
Sure, that makes sense. Somebody just wrote in and said, Alicia, what causes hormone imbalances?
So many things.
So many things, right? Endless list.
So obviously a big one is menopause. So women, that's inevitable. We can't avoid that. Women are going to hit menopause at some point. Life stressors can cause hormone imbalance, being stressed for long periods of time, illness, chronic illness, autoimmune disease, acute illnesses, COVID. I mean, we're seeing people with long haul COVID for a variety of different things that can affect your hormones. I recently actually just saw a patient that we're starting to kind of work back and think that this could be a long haul COVID symptom that she's dealing with for hormone imbalance. Different toxins that we're exposed to every day can cause disruption in there. Unwanted weight gain can cause disruption with hormones. A lot of like the fat tissue can hold estrogen, which puts women in that estrogen dominance area. Thyroid issues, kind of like what I touched on before, that can alter hormones. I always tell my patients, I always draw a triangle, and hormones, thyroid, and adrenals are all very connected. So if one of those are off, the odds are the other two are going to be affected. And one of the biggest effects for the adrenal glands is stress. So a lot of women that are chronically stressed will most likely have issues with their hormones as well.
Right. Yeah. I mean, stress is so insidious. And of course, women, I feel like, take on the most stress in our society oftentimes. We're taking care of everyone, right?
Yes.
But yeah, I'm glad you mentioned stress because it is something that can really, really jeopardize your health overall. Here's a great question. So Jennifer wrote in, she said, why don't bioidentical hormones prevent your body from naturally transitioning into menopause in terms of cycles and ending your cycles? Aren't you replacing what your body naturally wants to drop and allow your body to transition into menopause? I guess she's trying to understand the clinical way that BHT works. Can you maybe talk about that? Like if you're on, I guess, hormones and you're going into menopause, how does that work?
So when we see perimenopausal women or women before that, we can kind of stop the menopause symptoms that women are going to experience because we don't have that huge drop in not producing those hormones. So it is in our world, it is just accepted that women, when they hit menopause, they're going to have hot flashes. They're going to have weight gain. They're not going to sleep well. They're going to have osteoporosis. That doesn't have to be the case because you can replace those hormones with bioidentical hormones. So Traditionally, it's just, like I said, traditionally, it's just menopause is the way of life, and that's how you
Mhm.
deal with it. So we can actually kind of avoid those menopausal symptoms by giving our body those bioidentical hormones. So yes, that is the way that our body functions. It goes into menopause, and it, you lose the function of your ovaries, which is a natural process, but you don't have to have all of those side effects that goes with it. So we're not altering what the body is doing and what it's meant to do. We're just helping to keep the symptoms at bay and just keep you feeling really well without any side effects and things like that.
Right. I love that. You don't have to suffer, right? There's
Right.
answers and natural answers. You don't have
Right.
to go through that. Um, Great question just came in. Are there specific days in a woman's cycle where you use the cream that you were talking about, the bioidentical hormone cream?
Yes, that's a great question. So women who are cycling, um, progesterone is one that we alternate. So generally on days 1 through 14, they're going to get a lower dose. And then days 15 through 26 of the cycle, they get a higher dose, and then they break for their withdrawal bleeding. The reason we do that is to follow kind of the curve of the natural cycle. So in the beginning of a women's cycle, their progesterone is really low, then they ovulate, and then their progesterone gets really high because they're trying to get the body ready, get the uterus ready for implantation and things like that. With menopausal women, we don't have to cycle it at all. So you would just do the cream 6 days a week. We give a 1-day break, and that's it. So you will be on hormones the whole month. If you're cycling, you'll just break up that progesterone a little bit, but there's no specific days that you have to use the creams. You use them all month to keep that steady balance. And one thing that I did forget to mention, with testing of hormones, the best time to test hormones for women who are cycling currently is days 19, 20, and 21 of their cycle.
Okay.
That gives us the best reading. But as far as creams, you're on them all month.
Okay. That's great. Yeah, that was a really good question.
Mhm.
Let's see. Another one came in. Alicia, do you assist with cycle tracking to prevent pregnancy after coming off of birth control?
We can work together to do that. Yes. And that is a very good question, because I always tell women who are still cycling that if we balance your hormones, you are probably going to be more fertile, because we're setting the body up to, have a good regular cycle. So we absolutely can work together to, plan, look at ovulation to make sure that we're more conscious about making sure we don't have a baby or make a baby during that time. But that is something that does need to be in the back of women's mind when they are still cycling, is that you can increase your risk of pregnancy. So if you don't want to become pregnant, that is something that we work together to kind of help prevent that.
Okay, that's great. Let's see. Somebody just wrote in, is there anyone that should avoid bioidentical hormones?
A really good question. So I would say that women who have had a history of like estrogen dominant cancers, like ovarian cancer, breast cancer, they can still use bioidentical hormones. We just keep a closer eye on them. There's further testing that we can do to test the metabolism of them and stuff like that. But really, there really are no contraindications for bioidentical therapy. Things are a little bit different with pregnant women, like we don't put them on testosterone and things like that. But overall, no, there's really no contraindications to bioidentical hormone therapy.
Okay, that's great. Let's see, one just came in for testing hormones. Do you still test between days 19 to 21 while on birth control before coming off of it?
Good question.
That's a really good question. Yeah.
That is a very good question. When you're on birth control, it does not pay to check estrogen or progesterone because you have none. So because we're suppressing that, it does not pay to check that. You can still check testosterone, DHEA, sex hormone binding globulin, see what those look like. But with my patients on birth control who want to come off, I don't even bother testing their hormones until they've been off for 3 months. So I can still start them on that progesterone, but then I will not check levels until 3 months out, because there's going to be no estrogen or progesterone present to check.
Okay, that's great. Let's see, Jennifer wrote in, she said, my OBGYN challenges the notion that BHRT hasn't have enough years of research and data to say that it's less likely to cause risk than synthetic hormones. What are your thoughts on this?
Very good question. There is a lot of research, and I mean, I can find articles for you that show that bioidentical hormone therapy works and has less side effects and things like that. It is something that's going to be challenged. It's kind of like a lot of things in integrative medicine that are challenged. Synthetic birth control has just been around longer, so I think that's why it's more accustomed. I mean, you throw people on the pill, you don't think about it. This research is definitely newer, but there's still plenty of research behind it to show that it works. So many women are on it. There's so many articles that put studies side by side between synthetic birth control and bioidentical hormone therapy and things like that. So the research is out there. I think the reason it's challenged so much is just it's not as well known.
Absolutely. That's great. Let's see. Somebody just wrote in, are there any side effects of bioidentical hormone therapy?
Generally not. As long as we can keep you balanced. So obviously it's a slower process. You know, like I said, it takes a good 3 months to get people's cycles and things like that. But once you're in that balanced range, because they're natural and your body is using them naturally, there are virtually no side effects.
Which is pretty amazing. Something that gets to the root cause of your issues that has no side effects. And here, I mean, look at the laundry list of side effects with synthetic birth control that you brought up in the beginning.
Yes.
It's kind of a no-brainer in many ways. So, thank you everyone for answering or asking such great questions tonight. Doesn't look like we have any others coming in. And Alicia, I really appreciate your time, your expertise on this topic. I know you've helped a lot of women tonight, and we really just appreciate your time. If you're interested in learning more about bioidentical hormone therapy or would like to schedule an appointment with Alicia, call 920-922-5433, or you can visit forumhealthfondulac.com. Again, that's 920-922-5433, and the website is forumhealthfondulac.com. And in the meantime, visit us at forumhealth.com and connect with us on Facebook, Instagram, and YouTube. We have tons of great content on a variety of different health topics specific to women. So please check that out and engage with us on those platforms. Again, Alicia, thank you so much. And thank you to everyone for joining us tonight. We really appreciate it.